nails, then check for the lunula, which is this half moon at the base of the nail. Having a lunula is normal, so if you can see it, it's probably not Terry's nail. So both of these nail findings, Moiric's lines and Terry's nails, are both linked to low levels of albumin. Albumin is an important protein produced by the liver, and it's often quite low in the setting of liver disease. Next, I've got another test for you to try on yourself. If you love this kind of information and want your questions answered in a monthly live stream, then click the link up here to become a channel member. Put your nails together like this. Can you see a diamond-shaped gap between the bases of your nails? If you can, that's normal. But if you can't, and your nails look like this, it's called clubbing. And clubbing is caused by the proliferation of connective tissue between the nail and the finger bone, which makes it thicker than normal. While it can be genetic, if I see clubbing of the nails, I'm hunting for issues with the heart, lungs, or liver. I want you to take a look at this woman's belly. Your first thought might be that she's pregnant, but this is actually a very distended abdomen filled with fluid. This is called ascites. Shockingly, the abdomen can stretch and fill with upwards of 15 liters of fluid. So where exactly does this fluid come from? To understand this, you need to know about the portal vein. Basically, when you eat something, your small bowel absorbs what it can into your bloodstream, and all the blood from your digestive tract gets routed through the liver to protect your body from any dangerous substances that may have been absorbed through your intestines. The trouble is, as liver disease progresses, the liver becomes scarred and stiff, and that scar tissue starts to block the blood vessels going through the liver, making it harder for blood to flow through the portal vein. Think of it like pinching off a garden hose. It leads to increased pressure upstream in the portal vein, which we call portal hypertension. And because of all this extra pressure, a huge amount of fluid can leak through the walls of the portal vein and into the abdominal cavity. That's what causes ascites to build up. As you can imagine, this can be really uncomfortable for someone, and it can also make it difficult for them to breathe as the fluid pushes up on the diaphragm. So I'll often do a procedure called a paracentesis. This is where I put a large needle into the abdominal cavity and drain out that excess fluid. Here's a video of me in residency right after I completed a paracentesis. All those jugs are filled with liters of fluid that I drained out of a patient's abdomen, and you can just imagine how much better that patient felt. But portal hypertension doesn't just cause fluid buildup in the abdomen. It also forces blood to find a new route back to the heart. Since the portal vein is under high pressure, blood is rerouted through small veins that aren't designed to handle this extra flow. Think of it like Google Maps rerouting you through narrow back alleys when there's a major traffic jam. One place this happens is around the belly button, where tiny veins in the abdominal wall expand and become visible under the skin. This creates a really striking pattern of swollen, twisting veins. We call this caput medusa, named after the snake-covered head of Medusa from Greek mythology. And the same process can happen internally, particularly in the esophagus, where enlarged veins called varices can form. These esophageal varices are fragile, and they're prone to rupturing and bleeding. And people with liver disease have difficulty forming blood clots to stop that bleeding. This is what makes variceal bleeds one of the most dangerous, life-threatening complications of liver disease. And if you ask anyone who works in the emergency department, they'll have a terrifying story about this type of bleeding. This is palmar erythema. Notice how it affects the area over the thenar and hypothenar eminences and spares the center of the palm. This can be caused by liver disease, but it can also be seen in pregnancy. So what do these two things have in common? High estrogen levels. The liver is responsible for breaking down estrogen. And when it's not working properly, estrogen builds up in the body. One of the effects that estrogen has on the body is causing blood vessels to dilate or get wider. High estrogen levels can also cause little blood vessels in the skin to dilate, so they look like this, sort of a spider-like shape, which is how they got their name, spider nevi. A really cool thing about spider nevi is that if you apply pressure to the skin, you can push the blood out of the vessels and they'll temporarily disappear. Now, having one or two of these can be perfectly normal. Have 3 or more spider nevi, then your estrogen levels are probably on the high side. And if you're not pregnant, it would make me start to wonder about liver disease. Liver disease also leads to muscle wasting, but this can sometimes be subtle and difficult to spot. A good place to check is the palm of the hand because the muscles are small and close to the surface. Another good place where I check for muscle wasting is around the temples. So why does this happen? Well, the liver is responsible for processing nutrients, making proteins, and storing energy. But when it's damaged, the body starts breaking down muscle for fuel instead. There's one more thing to look at in the palm before we move on. See the puckering of the skin in this picture? And notice how this person's fingers are curled in and unable to fully extend? This is called Dupuytren's contracture. It's a condition where the fascia in the palm thickens and tightens over time, which leads to progressive finger contractures, especially in the 4th and 5th digits. There can be many causes, including a strong genetic link. It's actually quite common in people of Northern European descent, and it's how it got its nickname Viking disease. So let's try a test together to check for Dupuytren's contracture. It's called the tabletop test, and all you do is lay your hand flat on a table and see if your palm can touch. If it doesn't, it could be because one or more of your fingers is too tight from a contracture. Here's another really useful test that I use all the time in the hospital, and it's easy to do yourself. Hold your arms out straight while extending your wrists and fingers. For most of us, that's probably pretty easy, right? But in liver disease, patients can develop an involuntary flapping hand tremor called asterixis. Here's an example of this in a middle-aged woman with advanced liver disease. And the reason behind this flapping movement demonstrates an interesting link between the liver and the brain. As you know, the liver is responsible for clearing out toxins from our body. And not just toxins that we ingest, like alcohol, but also toxins that come about from normal cellular function. One of those toxins is ammonia, which is produced from the breakdown of protein. Normally, our liver can just clear that away. But if the liver is damaged, then ammonia levels build up and that affects the brain. This is called hepatic encephalopathy. And the reason this flapping tremor happens is that the brain can't sustain muscle contractions. So it's like the brain sort of forgets, and then when it remembers, it starts contracting muscles again, and that causes this flapping movement. But hepatic encephalopathy can be far more serious than just a tremor. I remember one time I was assessing a patient who had come into the emergency department after his friend had found him unresponsive. Fortunately, his vital signs were stable, his blood sugar was normal, and there were no other signs of critical illness. So I did a really hard sternal rub to try to cause a little bit of pain and wake him up, but still no response. During the examination, I couldn't help but notice a really distinct, musty, sweet smell on his breath. I recognized that smell instantly. It's called foetor hepaticus, which is Latin for foul odor of the liver. Basically, it's caused by toxins like dimethyl sulfide that build up in the blood and then get breathed out with carbon dioxide. So I ordered stat blood work, which showed a very high ammonia level. And it turned out that this patient hadn't had a bowel movement in 3 days. So what? This patient became so constipated that he became unresponsive? In a way, yes. You see, bacteria in our intestines break down proteins and produce ammonia, which then gets absorbed into our bloodstream. Unfortunately, without regular bowel movements, there was an overgrowth of ammonia-producing bacteria in his colon. And because this patient had liver disease, he wasn't able to clear the ammonia from his body, so it built up and poisoned his brain. Fortunately, it's reversible. And interestingly, the treatment also has to do with the gut. We give a specific laxative called lactulose, which gets things moving, and it also converts ammonia into ammonium, which doesn't get absorbed into the bloodstream as easily. It's amazing to see how a laxative can clear somebody's mind and even have them wake up from an unresponsive state. Now, let's look at that video of asterixis one more time. Do you notice how her skin looks a little bit yellow? This is called jaundice. Basically, your liver is responsible for processing and eliminating bilirubin, a yellow substance produced when red blood cells break down. But when the liver isn't working properly, bilirubin can build up in the blood. And if levels get high enough, it can be quite dramatic, even changing the color of your urine to a dark yellow or a brown tea color. And this isn't the only cause of tea-colored urine. I made a whole video about what your urine says about your health, so I'll leave a link in the description in case you want to watch that video next. Easy bruising or bleeding is also another concerning sign. Now, I'm sure we've all noticed a bruise once in a while and thought, where did that come from? But if that's happening a lot, or the bruises are really big and taking a long time to go away, that could be a sign of liver disease. Now, your body creates blood clots to stop bleeding. And to make a blood clot, you need clotting factors and platelets. Clotting factors are proteins created by the liver, And in liver disease, those levels decrease. Platelets, on the other hand, are tiny blood cells that clump together to stop bleeding, and they're produced by the bone marrow. The liver comes into play because it makes a hormone called thrombopoietin, which tells the bone marrow to make platelets. And in liver disease, there's less of that hormone, so you end up with fewer platelets. And to make matters worse, the spleen is often enlarged in liver disease, and that can sequester platelets and take them out of circulation. Unfortunately, there's really no cure for liver disease, aside from getting a liver transplant. So prevention is key. I can do a whole video dedicated to this topic, but here it is in a nutshell. The top preventable causes of liver disease include alcohol, so minimize the amount that you're drinking, metabolic syndrome, which is linked to obesity and diabetes. This is probably the most common cause of liver disease that I see in the hospital these days, and the key to prevention is maintaining a healthy weight. And then there's chronic viral hepatitis, so that's hepatitis B and C. We have a vaccine against Hep B, so I highly recommend you get that. And about 10 years ago, a cure for Hep C was developed, which has been game-changing. So hopefully that will no longer be a significant cause of liver disease in the future. If you enjoy learning about signs of disease that you can see for yourself, then check out this video next to find out what your hands say about your health. Stay curious, stay healthy, and I'll see you in the next video. So, bye for now.
Good morning again.
Good morning. We're all here,
Okay.
I think.
Morning, CJ.
Good morning. Good morning. Sylvia, can you hear me? Okay. Just
Yes,
checking.
CJ, I can.
Absolutely.
Good morning.
Before I say anything this morning, any comments? Any comments?
Just a statement. What I've gathered is that the important function that the liver plays in our lives. And that means, of course, we have to take best care of it. And what is scary to me most of all is that there is no cure for it. So that says it.
Not only that, Sylvia, thank you, Sylvia. Thank you so much.
Most welcome.
That's not the only scare. The real scare is that when you hear that there's a liver issue going on, guess what? Can anyone tell me? When, by the time you hear that the liver is failing, it's compromised, can anyone tell me what's going on right there? Come on, family.
It's all gone, huh?
It's all gone.
It's too late.
It's too
It
late.
is definitely.
So, to all Atomians on the call this morning, and to the guests on the call this morning, trying to get rid of these calls that come in fast and furious this morning. Okay, okay. Bear with me. I'm going to end that in a minute. Okay. Okay. Gotcha. Thank you. I apologize, family. So, we all need to be so proactive about not only our health care, our liver health, but also those around us. Now, what we did this morning is to, although we're not doctors, I make no medical claims. I reveal my hand. I'm not a doctor, but that doesn't prevent me from being able to look at someone's tongue, someone's fingernail, the palm of someone's hand, and to make some reasonable, intelligent determination. Look at the eyes. Do we understand what jaundice is? Okay, so with that said, the good news is that in our Atomy Wellness store, we have a product that can help to restore that liver, bring it back to optimum working condition, if that's the right way to say it. The rhodiola, milk thistle. The science is out there, the research is out there, the information is out there. You can't say you don't know or you never knew. Alas, about a month ago, I am in the hospital. I think I've told the story before on the show that I'm in the hospital visiting uh, a friend of mine whose wife was in the hospital. And while I was there, at the time she was in a comatose state, I turned to my good friend and brother and said, "You, you are anatomian. You know about hemohim, and you know about milk thistle. What's going on? Why are we here?" And immediately he put his hand on his head and shouted out, "Oh my God! Oh my God!" You know, family life happens. And yes, we are all engaged in the dance of life. We get distracted. So much noise out there, which is why this morning I purposefully and in the most intentional way decided that we'll take a minute and we talk about liver health. Well, sadly, his wife passed. It was too late. She was admitted to the Cleveland Clinic to hopefully was it was all about getting a liver transplant, but it was too late. I am therefore inviting all of us to do the right thing, to proactively be going after our milk thistle with the rhodiola, and as we engage with folks around us, be cognizant, be observant, be listening. There are folks around us that are in pain. They are dying slowly. Their 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 gut system is inflamed. It's compromised, and it's their eyes are showing the level of this gut health being compromised. The colon is compromised. And by the way, I'll take this opportunity to say to the family this morning that you know a lot of the a lot of the blurred vision, the irritability, the lack of not being able to focus and to concentrate, and even memory, memory loss. A lot of this is because of what's happening in the colon, the need to be detoxing. So here we come right back to our hemohim. Folks, it's that time of the year again when the allergens are running wild and the temperature changes and so we succumb to the sudden change in temperature. Yeah, we pick up the flu and then it can escalate. So hemohim to the rescue, and our of course our milk thistle. So any comments this morning?
Good morning. Good morning.
Good morning,
This is Igor.
Mr. Igor. Good to have you, my brother.
Yes. For just on my part, the
Yes,
milk thistle. For
yes.
some reason, when I take it myself, if I do it too much, like every day I take one,
Mm-hmm.
in the middle of the day, I have a nosebleed. So I slow
Mm,
down. I take one and I skip a day or so, and I
okay.
do have some relief. But for some reason, if I keep it on a regular basis, I get nosebleed. And I've read on it, if you take it too much and you have a nosebleed, you just have to slow down.
Okay, reasonable. That's good. All right.
Uh,
So the
so,
good news is, Igor, that you are being proactive about your health, and
oh,
I
definitely,
applaud.
definitely.
Oh yes, oh yes.
The older
Um,
you get, the more
yes,
proactive you have to be. You know,
Excellent.
we're not as young as we used to be.
Thanks for sharing that, Igor.
You're welcome.
Um, yes, sir. As we grow older, the mitochondrial powerhouse, it begins to diminish. It doesn't do what it's supposed to do. Again, you don't have to be a medical doctor to be talking like this. But if you are a crusader, welcome, welcome, Mr. KJ. I say, look, if you are on this call this morning, if you claim to be an Atomian, do research. Okay, the folks are around us crying for help. There are two issues going on around us right now that is creating a panic. It's a crisis. We have a health crisis going on, and we have a financial crisis going on. Which by the way, in the coming year, God's willing, we will dedicate a minute from time to time to take a little look into our financial wellness situation. But your health is your wealth. Your wealth is your health. We took a minute this morning to see what's going on in the liver department, and we are taking a minute to see if we can, while we don't claim to be medical practitioners, there are signs, there are clues, and if you inform yourself, you can be of tremendous help to family members and to those around us. Be vigilant, be alert, be aware, and become a crusader. All right, so with that said, I want to just make sure that if there are those who want to make a contribution, add value to the conversation this morning, feel free. Go right ahead.
CJ, for me, I will of course take better care, or best care, I should say, of my liver. I think I was doing well, but then I'll have to give it my best shot. And of course, I will share the information as best as I can. Yes,
Thank you
sir,
so much.
because I don't want to go that
Yeah,
route at all. Not taking care would lead me. I don't want to get there.
for those of us, Silvio, who are on the call this morning and, you know, do Bible, you know, there is in the Bible, the prophet Hosea, in his eighth scroll or whatever letter, his fourth verse, he says that my people are destroyed for lack of knowledge.
Hmm.
And this is not only something that is a spiritual truth, it's a truth of life. People are destroyed for lack of knowledge on the financial front, on the
Yes.
health and wellness front, on
Yeah.
any front, wherever you want to place that equation. Ignorance can lead to death. And so from time to time, Sylvia and Michael, you'll hear me say, and I've coined this expression over the years, the greatest thing is to know. When Solomon was I think he had a dream or something, he was asking God for, God was giving him uh, was going to bless him, and he said, "Give me wisdom, give me wisdom." See, um, money and prosperity and wealth, that's standard, but ask for wisdom. So the greatest thing is to know. I do not want to be talking like this, so let me invite anyone else who might want to add value to this morning's Momentum Morning conversation. Okay, um, it's your turn. It's your turn. Just to remind you that in the chat this morning we have the motivational video. It's in the chat, and um, and also the milk the 12 signs of liver disease. It's over in the Momentum Mornings chat. So you can hop over there and grab it and use it as a marketing tool. Okay. So Here we go.
So,
Any,
CJ, that means that we'll have to be the watchmen,
but
and
that's
we'll
what we
have
are.
to.
I tell you this, Sylvia, and I make no bones about it. And I say to, folks who will listen, if you are a
Yes.
crusader, you need to do something. You need to brand yourself. So I believe in branding. It's a big part of marketing. It pays to advertise. So if you are serious about Atomy, you need to be telling the people around you that this is what I do. You know, um, so if it's not coming through in your chatter, wear it, tell it, don't hide it. So yes, Sylvia, you are a crusader, and you are here to you're interventionist. You're a change agent. So let's do what we are called to do. So
Okay, sir. Thanks.
that's what we
May I say something, CJ?
absolutely,
Igor
Igor.
here. There's something that all of us can do. We have to learn to study, practice,
Yeah.
and teach, meaning that we have to study the product, learn about the product, use the product, and share the product. We all have to do that. And if we're not doing that, we cannot share what we have. So we have to spend the time to educate ourselves about the product. We may not know everything about every product, but choose one or two and let's learn it the best we can. And you're gonna see a big difference when we're talking about the product to somebody else. So we have to do a lot work. We have to do a lot of work for ourselves to educate ourselves. Coming on the call is great, but when we're not on the call, you still have to educate yourself. Remember, on YouTube, we have a ton of videos. I usually
Yeah.
tell people I don't just look at videos about Atomy product. There's other product that's there. People talking about them, but we have them in Atomy. They just doesn't say Atomy on them. But you could listen to a doctor talking about milk thistle. There's a lot of video about milk thistle on YouTube. So we have to spend the time to educate ourselves. You may not have
Thank
a
you.
lot of time just while you're driving. If you could put a video on YouTube and just listen to it while you're driving, that's good. And that's going to motivate all of us to do even better every single day. Thank you.
Thank you, Igor. Thank you very much. So here's a paradox, Igor. There was a time, um, before I say that, Atomy has been is now in the United States over 10 years. And so few folks know about Atomy. And you know what is alarming, Igor? Him or him for what it does. And by the way, it's the number one herbal selling herbal supplement sold globally. It's the number one. And here in the United States of America, 360 whatever million folks don't know about him or him. I find it that's such a paradox. And here's another paradox, family. I find it alarming that when Atomy came into existence, it was all about Hemohim with one product, and then the two and three and four others. Now we have tons of product. We have we have the U.S. mall, we have the Korean mall. We have so much more. 10 years later, and in the United States of America, we still don't even have one Imperial Master. Not only that, you can go to YouTube. It's washing away with information, videos. You have TikTok, Instagram. I'm telling you, I'm amazed every day on my phone. something is popping up on TikTok that is advertising uh, uh, Atomy and the range of products. So I can only ask the question: what is wrong? What is preventing us from going out there and really seriously representing? We have Atomic Channel, we have Momentum Morning Channel. It's just the information is just there. So thank you, Igor, for reminding us that let's study what we have. We really have some great products. The hemohim, the fermented noni, the milk thistle. We just talked about the liver just now. The Hamsung dung, the pomegranate, the spray. I hear Sylvia talking about she doesn't leave home without it, and Novlet talks about it. That amazing. What's the name of that spray, Igor? Come on, tell me. The propolis
The
spray.
propolis.
Yes, yes, and especially at this time of the year, we need to have that close at hand. So, thank you
And if you
for.
don't have that, you could use the toothpaste. Take a little bit, put it inside your mouth. You could swallow it. It's not gonna do anything bad to your body. And it's
Mm,
gonna be refreshed. Because
mm,
remember, it's green tea and propolis.
yes.
So don't be afraid to use the toothpaste. If
Oh,
you
I
have a
won't be
sneeze, a
afraid.
cough,
Yes, right. That makes sense.
CJ, you have forgotten to mention how it helped my dog.
You
Not only me, but my dog as well.
and your dog, and your dog.
Yes.
Quite so, quite so. Don't forget about the dogs.
No.
All right, family, listen. If I'm not getting any other interaction, if no one else is going to share this morning, then
Wait. CJ, I love
ah,
to say something, my brother. Oh, good
yes,
morning,
Christy.
everybody.
Good
Good morning,
morning.
CJ, man. Look, I'm hearing this conversation, man.
Yes, sir.
Look, look,
Yes,
you
ma'am.
and I, we can see what's going on. I gotta say
Yes,
something, guys. I really want to
yes,
say
ma'am.
something, CJ. You know,
Okay.
I started out with and you're right, CJ. People are lost. And why is that? Well, here's the facts, right? If it doesn't start with growing up as a kid, your parents don't feed you the information, don't know themselves, yeah, it's kind of like you're the product of the environment. Just to say that, right? The lack of education, the lack of knowledge. Because here's one thing I want to mention, CJ, is that, I never understood. I never understood. First of all, let me explain. I want to share this real story real quick, CJ.
Yes.
Guys, I want to say this. This is the worst. I grew up differently. I'm going to use myself as an example, CJ. This is what's happening for me. Growing up, my both of my parents didn't teach me jack. I'll tell you straight up. The only
Mhm.
two things they taught me, my father taught me discipline. If you don't get it right, you get a belt. That's old school. The other part is
Mm,
that, yeah, you see what I'm talking about, right? The other part is that my mother, she told me love others and help others because they will help you back. Today, world today, we live in a
mm,
world that people is for themselves because the social media, people talking to themselves. They learn through the social media. That's the only way they communicate. If they get bored, they forget the important message. They move on to the next thing. We in the fast pace today, but back then, when there's no social media and the time cell phone just coming out, they had beepers at the time. Yeah, those
mm.
things was like everybody was outside, was just wanting to find something to do. hmm But I want to say this, CJ, real quick. My parents never told me what is school, why I was going to school. I was crying because I thought my parents didn't want me no more when they sent me to school. I was lost. What was happening?
Mm,
But then as I grew up, CJ, this is one thing I've learned too. I never understood with all these different subjects like math, science, all these other stuff. I had to grow into it, right? We all had to grow into it. It was forced into us because we had to learn. These was things in school. The thing is that they didn't put it in the curriculum in the school for us to actually learn the health part, learn to do right. Everything is always like, strip this, want the political, we want this, and we want them to learn this and this and that. But the good stuff for really to have long, healthy longevity, that was not in play until I got to college. And this is where you start learning about, you got to have learn about health. And my gosh, there's so much part of our body. And if you ask yourself how many muscles you have in your body, everybody will scratch their head. I don't know. Well, probably, we may have like 157 muscle. We may have 150. Now, that is not the correct number, but I just want to share with you. That's something that we should learn because your muscle, your body, it's so important. Our body's like kids, guys. And we don't take care of it. We abusing it like ain't nothing because it can't talk back. Yeah. Yeah. You feel mighty when you do things to yourself and it's not right. Education is short, and especially wealth. Without I never understand why we live in a rich United States and a lot of people are struggling. I never understood that as a kid, but then it took a
Yes.
long time to make me realize financial literacy. Yeah,
Yeah.
if it's not in place, the principle is not in place. Yeah, CJ,
Mhm.
it's a sad story when everybody grew up and when they become an adult, everybody want to learn by using their eyes if they don't use the brain. I had to learn the hard way to not use the physical after I got my transplant. I had to use my brain. This
Yeah.
is why this is why I put a lot of time. My first time
Yeah.
journey with Atomy, it took me
Yeah.
a long time to figure it out, but I had to do a PowerPoint presentation. And now I'm one of the key speakers that's going to be speaking in English for Atomy, right? But there's a
Wow.
lot that's going to be more coming. So I'm expecting to put a training PowerPoint. And one day, CJ, as soon I'll let you know that I would love to do this with the momentum to actually break down all the levels for everybody should start learning. But here's the facts. I'm only not going to look at doing that. I'm also going to use what and now the sales master, diamond master to really understand that. So I'm working on some too, guys. I'm gonna help. I'm gonna really put this and forward with the momentum, and I'm working on it, guys. I'm trying for next year. You guys are gonna see something new, and I'll add that. I'll
Hey.
step that and let CJ give the big announcement when that time has come. Back to you, CJ.
Thank you, Mr. KJ. And I applaud you. I know what's going on. Listen, I tell you this, KJ. I've told this to others on the call from time to time. I'm watching you. You may not believe me, KJ, but honestly, I can tell what's going on the other side. It's a some kind of a acumen. I don't know what it might be. I don't have the I might not have the right word to describe it. But I really do applaud you and the your consistency, your commitment, KJ. I really want to drive home the message that we who are here on the Momentum Mornings platform, we come to the show. I really want to say this. Take this thing serious.
Absolutely.
Take it ever so. The reason why it even exists, KJ, the reason why Momentum Mornings even exists, it is to wake up and to shake up the people
Right.
because we have been privileged. Okay, let's step back a minute.
Okay.
Mr. Chairman Hans Park Gill. I don't know him, but I know we'll be talking soon because that's where we're all heading. Uh,
Yeah.
all the way over in South Korea. To go there, that's 16 hours of flying. Okay.
Right.
So Hans Park is in the hospital. Why is he there? His liver is failing or his liver has failed. Something is going on with his liver and he is getting ready to die. Are you hearing me, KJ?
Loud and clear.
So what's happening is right there in the hospital, someone introduces him to him or him.
Mm.
Are you feeling me right now, KJ?
Yes, yes, I'm
He
feeling you.
So his family is there at his bedside, and he prays, God, if you get me through this, I'm gonna go represent. He
Mm.
didn't die, KJ. He was getting ready to die.
Oh my
So
gosh.
here we talk about Hemohim. Ladies and gentlemen, welcome on stage, Hemohim. Hans
Mm.
Spark recovers from his liver condition, and he starts atomy. Are you with me, Mr.
Yes,
KJ? So
yes,
I,
yes.
I keep saying from time to time to time to time, I say to Bob and to others, Hans Spark Gill,
Mm.
Honorable Hans Spark Gill, who by the way is a pastor, preacher, whatever.
Oh
He
yeah.
starts after me. And him or him is the number one herbal supplement selling worldwide. Okay? Every three
Yeah.
seconds somebody buys him or him. Now you're telling me that we here on the Momentum Morning Show, we come morning after morning and we don't even invite a guest. By the way, hats off, Mike. It's good to see you on the call with me this morning. Thanks, glad to have you. But listen, this is a platform that is designed to propel your business forward. It's
Exactly.
you're giving a gift. So Hans Park gave us Atomy, a marvelous platform. What you have there on your phone, right there in the palm of your hand, is the
Mm.
gateway to a multi-million-dollar business. Wellness is $1 trillion business. We have
Absolutely.
Hemohim, who there with prostate cancer. I have two guys that have come back from prostate cancer. Okay, there is Brenda in Jamaica who she was given 3 months to live. She was given 3 months to live, KJ. The doctor said, I can do nothing. We can do nothing for you. Just do what you got to do.
My
She was
gosh.
introduced to Hemohim. So she got her Hemohim, her vitamin C, and the omega threes. It's
Mm.
3 years now, no
Wow.
cancer. So the
Oh,
question I ask is, guys, what's going on? Momentum Mornings is designed to get you up and running. So we take a good 15 or so minutes doing our little motivation prep. Get up, get up, get up. The things to be thankful for, to be grateful for. This is why we do what we do. Where are you in your life? Are you over? You pre-retirement, post-retirement, whatever it is. This is your retirement business. This is it. And
mm.
you have absolute products, absolute prices. The food that we are eating is compromised. The water that we're drinking is compromised. We are diseased. We have
Mm.
something, or we have products that are so, so, so good. What are we doing? So I keep saying it from time to time. Hans Spark Gill has done all that he could possibly do. From your hair, we have the Vital shampoo that is guaranteed in 4 weeks to begin to regrow hair. It was introduced in April of last year. And
Mm.
I can tell you this, KJ, so few people right here in America in on the Momentum Morning even know about the Vital shampoo that is
Mm.
guaranteed to regrow hair. We have the toothpaste, with all this the propolis. It is even beginning to restore gum. Okay,
Mm.
we have the eye products, the Lusanthum. We have the microbiome products. Listen, KJ, do you understand what we and then we come right back to the Hemohim, the standalone product. We have the Noni. So Hans Park-Gill has done all that he could possibly do. The rest is up to you, KJ. It's up to Sylvia. It's up to Ruth. It's up to Patience. It's up to Sabrina. It's up to Joy. It's up to you. And the good news is that you are sitting on top of a gold mountain. This business, if it gets into you, is $1 trillion industry. All right, so that's it for today. If there is no one else, if you um, want to say something real quick before we wrap it up, it's now
Uh,
2,
uh,
3 minutes past 11.
Before I let the other person say, just before I let someone else to say, I want to say a little thing real quick, CJ. Just want to say last thing, just real quick. Uh, Listen, guys. In America, I'll say this, especially with somebody who's dark skinned, right? And we go to the opposite skin, or we go to the opposite culture. We speak to folks about it. They shake their head. They would shake their head. It's like you tell them about information. If you mumbo jumbo about this is good, this is gonna help you do well. People gonna look at you like, okay,
Yeah,
are you
that's true.
selling me? Or are you educating me? And so if you're selling me, some people find it as a turnoff. But if you educate, like everyone tell them about, read about the product, you'll find yourself going places. And that's something that is kind of tough. Take notes, find the keywords that you enjoy that you can pick out of the each, especially the herbs. Herbs, herbs, herbs. It's a plant-based, seed, vegetable, fruit. Keep it simple. Nothing hard to do. That's what's in it. Find out what's in it. If you don't know what the name of the flowers, you don't know what the name of it is, use the translator to help you pronounce the word and start speaking it. Try and record yourself. Start doing that. And then you will find yourself, are you getting the word? Are you understanding? Are you comprehensive? You got to go to the extra mile. I know work is taking all over you, but how would you going to learn anatomy if you just jump and jump to jump and don't really take the time? It's kind of hard. It took me a little second, but when you finally have it all coming together, you'll be amazed about yourself. You started going to speak like CJ, and then you're gonna start speaking like Miss Novelette. Next thing you know, you're gonna find yourself going places, become impaired master.
Of course.
CJ.
Going beautiful. KJ, I
Yeah,
really, really want to thank you
thank you.
so much for your sharing, and Sylvia and Ruth. And I really want to invite everyone to own your business, own this global platform that you have. You have been privileged to become your own CEO, right? Become a crusader in the true sense of the word. And you'll be surprised what will happen when your phone begins to ring. You don't know from where, from people coming from England, from Colombia, of course, from Jamaica. Uh, what should I do? What should I take? It's a wonderful thing, but it just doesn't happen by itself. It happens when you represent. I tell you what can really help also, and you're right about using the right approach. Listen, send the video. They are there. The same milk thistle and liver health. You do not know who is struggling with liver with compromised liver health. Use the tools. We have everything. It's all there. So from time to time to time to time, you send a video. It's the hemohim or the milk thistle or the noni, and sooner or later, folks out there will associate you with Brandon. KJ, he's always sending me things about that is health related. So automatically, over time, you brand yourself. Branding comes by way of consistency. It's not what you do one time, it's what you do all the time. And gradually, the calls will come. You have to establish, you need to own this segment of the market. Don't hide it. Please, folks, come out of hiding. Don't hide it. Tell it. Atomy will pay. You'll get there. Become consistent. Be
Amen.
consistent.
Amen.
So, KJ, you were right this morning. Let's get into studying and researching this thing. And the third party validation. Do not try to uh, sell or tell. Just send a video or some NIH document. It's already done. There's nothing for you to do. You don't have to speak. And better yet, just invite your friend, your guest, your loved one on the call. And that's it. The call will do it. The call will take care of all the questions, whatever that the individual may have. So, any last words?
Yes. Ladies and gentlemen, the same way you read your Bible in the morning and at night, it's the same way you have to do atomy. Even if you're not placing an order, you have to go on your back office on your website just to have the habit of going in there and looking for the product, read some of the product, what they say about the product. That's how we have to do it. I'm not a Bible person per se, but I know that there's people here that pray in there with their Bible in the morning, and then they pray in the middle of the day, and they pray at night. So we have to do atomy the same way. Thank you.
Thank you, Igor. Quick announcement. Novlet should be with us tomorrow. You know, Novlet, she does what she does, and we love her, and we hope to have her doing her thing tomorrow. Thursday, that's the Cosmeto Millionaire. Everything's beauty related, and on Friday, of course, the illustrious Nick will be in the house with us to go through some back office technical stuff. So that's it for today, family. We will be doing this again tomorrow morning, 9:45. Pre-game, 10 o'clock, showtime. Have yourselves a wonderful day, a productive day. The run continues right down to the end of December. Breaking Sales Masters, breaking Diamond Masters, breaking Sharon Rose Masters. Let's do it. Let's brand ourselves and let's get out there and represent. So for me, have a great day. And it's Aja, Aja,
Aja, Aja, Aja.
Aja.
Ja,
Thank you.
ja,
Send you
ja.
love.
Thank you. You do
Thank you.
likewise, CJ.
Take
Thank you,
care.
thank you.